Mark, LifeFlow has been used at your hospital, WakeMed, for many years. What kind of impact on patient care are you seeing in a large level 1 trauma center?
Yeah, we've seen impact across the hospital in a variety of conditions. So, in my own ICU, pediatric ICU, we see the need for immediate resuscitation in someone who's post-arrest, for example, or a septic shock, or someone who's bled after an operation. Our nurses can immediately respond and get them resuscitated quickly, get the blood pressure improved in minutes. We can watch the dose and response, and we can decrease the negative impact of that situation for that patient quickly, and we all can observe the effect before our eyes.
Were there any patient populations that were surprising to you that you didn't initially think about for LifeFlow?
Yes, and that would be obstetric hemorrhage. So women coming into the emergency department with severe delayed postpartum hemorrhage, or ruptured ectopic pregnancy, for example, with a lot of blood in their belly, arriving hypotensive, and similar to the trauma patients we discussed before, they may need a heroic intervention. They may need intubation. The mental status is not good. The patient's spiraling down. But an immediate dose of blood or fluid, if that's all that was available, has in many cases brought about reversal of the shock, stabilized the patient, and in some cases the baby, so that the mom could get to the operating room quickly.
Outstanding.
And we actually have presented some good outcomes on those patients in some research data. I'd also say patients arriving to a non-trauma center with a GI bleed, or you name it, many conditions that we may not, a post-operative tonsillectomy bleed where someone's in hemorrhagic shock and needs resuscitation quickly, and we don't have the typical tools and trauma team assembled for that. A LifeFlow can allow quick resuscitation in those patients. So we have seen a lot of impact.